Hello, everyone. This is Dr. Marzban from Carrollton, Texas, Marzban Family Chiropractic Complete Injury Centers. Today, I'm going to be talking about something that many of us have experienced and we asked the doctors, why do the treatments not working? And I've been coming for that many times, or I went to the doctor and he did this or that, or she did this or that, and didn't work. And we would like to see that what could be the cause of that. Here we are. And it could be the wrong diagnosis, and that we talked about that in the previous uh, video clip. And we said that diagnosis is very major thing that would help the doctor to know that what treatments the patient needs for the issue that the patient is presented in the office. Without the good diagnosis or the right diagnosis, treatments will just not be the right thing most of the time because you're just guessing. Or the wrong treatments, and the doctor does the diagnosis correctly and doesn't know how to treat. And that is not going to do a good thing because you're treating with the with wrong tools. That may not be solving the problem. It could be either with the medicine or with the therapy or anything that you can guess. Or the doctor is falsely promising that something is going to work, and but it is not as straightforward, or it doesn't talk to the patients fairly, and wants to give the hope up, or trying to make it not clear to the patient for one reason or other. And the other one is that the life of the patient is not being discussed, and so most of the time, many issues that the patients have is related to the lifestyle plus other things. And wrong diagnosis can lead to wrong treatments. And why the doctor might have a wrong diagnosis? Well, it could be the lack of knowledge about the issue that the patient is presenting in the office. And there are most of the doctors are specialized in many cases, and they have a tunnel vision. So they see something, and the other doctors see something else, and they are diagnosing different things, or both of them could be right, or all of them could be right. And but the treatments should be something that would be covering the issue. And so the patient might have multiple issues at the same time, or the doctor is just focusing on something that is correct, but other things needs to be considered. And one of the issues that the uh, treatments could be going wrong is that doctor is not fully concerned about the issue, and they're trying to come up with the some excuses to make possibly money, and that is the big issue, especially when the insurance comes along, and so the doctor is just trying to follow the steps in the insurance cases so they can come up with the uh, convincing the insurance company to pay the treatments. But the other treatments that they are following to do is just because they want to cover the bases that insurance does not, deny the case. And sometimes the doctors is just trying to do things and make the money, and that happens in many cases in all different fields of healthcare. And I'm not And have experienced that some of the surgeons could do that, and because they just know that they have to go through the steps like the therapy and this and that until they get to the point that everything says that, well, it's not working because, well, the treatments were wrong, and so it's not working, so let's go to do the surgery. And unfortunately, surgeries may not be the right thing for the patient because other things were not done correctly. And lifestyle is very important. So, am I doing the right or am I doing the wrong? And it is important to discuss the lifestyle with the patients. And many cases, patients they have issues because the daily life, especially with the sedentary type of lifestyle or sitting behind the desk doing the computer work, or even doing the other jobs that needs and requires body strength. And all of those could be issue that the patient is having that problem. And so you might have the right treatments for the patient, but if you don't discuss the lifestyle changes, then the patient is not going to be uh, having a good success with the treatments. And so here we go that here's a lack of knowledge and the doctors doesn't have the wide area of understanding of the issue that the patient is presenting, or it could be because of the multiple causes. So this doctor sees one thing, this doctor sees another thing. So if this one is trying to solve the problem, it follows the treatments that is going to help with what he diagnosed. And this lady, this other doctor, is trying to treat the patient based on what she understood about the cause of the case. So it is important to have open-minded and have all the options, not only as far as the diagnosis goes, all the options as far as the treatments goes. And sometimes it's the lack of caring. Money is the driven part of the making all the decisions. So to make this discussion or presentation into the point that we all understand the issue is that making sure when you go to see a doctor and that doctor is reliable and also ask all the questions what you would like to get the answers and satisfy with the all the answers. That don't mean that ask all unrelated uh, questions and sometimes the patients should have good listening and listen carefully and try to understand what the doctors are saying. But also, many cases, doctors are not trying to communicate with the patients, and it seems like they are wasting their time. So it is important that we all on the same page and we do things with understanding mutually. You have a wonderful day. Bye bye.